Hi, I'm Kristin Pelletier, founder of KP Consulting, where we help dentists reduce stress, increase profitability, and create a practice they love. And today I want to talk to you about inactive patients and where are those patients and why aren't they coming back and when do we give up on them is really the question. And in many offices that I go into, I just see various protocols, usually decided on the fly by team members on when we should inactivate a patient and decide, we've called them and they haven't responded, so let's just move them to this inactive list. So our lists aren't cluttered. And it's interesting because what I see sometimes are teams trying to clean up their lists. And if you think about that, we're trying to clean up our lists. So I don't like a long to-do list, right? I'm sure you don't either. And so anything we can do to clear it up sometimes feels like a relief. But when it comes to your patients, don't give up on them too soon because maybe you've even, let's say, tried to get in touch with them for a year and then you decide, you know what, it's been too long. We haven't heard back from them. Let's inactivate them. And look how pretty and clean our list looks. It's not 50 pages long anymore. Now it's down to 4. But what really is happening is you're taking those patients and then moving them into a category that will keep them from receiving all of the necessary communications to stay active in the practice. So I have a certain family member, I won't mention names, who went 5 years without going to the dentist. I was pulling my hair out because I am the dental police for my family. And so just, reminding and saying, hey, it's been 2 years, it's been 3 years. And finally, I just had to let it go. And the office where this family member was a patient, I am sure that they gave up many years ago because it had been 5. Now, I want you to know that if you would have asked that family member, do you have a dentist or who is your dentist? They would, without hesitation, mention the name of the practice where they last had dental treatment. And so to a patient, sometimes 1, 2, 3, even 5 years or more can go by, and if they still consider you their dentist, we want to keep them as active in the computer system. Now, some softwares will give you the option to either inactivate or archive. So what I recommend is that you never archive a patient unless you know that they're not coming back because they've requested x-rays, they've moved out of state, they're deceased, or they made it very clear that they weren't coming back for whatever reason. You can still reactivate them if they do come back, but you only want to archive patients that you know aren't coming back into the practice. Now, if you're allowed to use an inactive category without removing them from your lists in the practice, your continuing care lists and your lists that will allow them to get communication, you can use that status. But when I say we need to not inactivate them is we don't want to write them off and categorize them in the software so we're not communicating with them anymore. A year is not long enough. To a patient, not going to the dentist for a year doesn't feel like a long time. So I want you to look at this as potential and an opportunity in your practice to go back a few years, maybe 3 years, and see if there are some patients that still consider you their dentist, but maybe your practice hasn't communicated with them in quite some time. So your assignment is to go back, see if there are patients that you can reactivate, and to not give up on your patients too soon. I hope this tip was helpful. Visit my website, KristinPelletier.com, for more practice management tips.